Are you having a tough time recruiting and retaining healthcare professionals in our country? Maybe you're listening to me somewhere else around the world. Here in the United States, it's very difficult to recruit, to train, and retain good healthcare professionals, especially in senior care. But I know they're lacking in hospitals, hospice, home health, everywhere. So my topic for you today, I'm Dr. Jim, by the way. How's it going? Dr. Jim Collins here at your service. My topic is recruiting and retaining healthcare professionals, but specifically in rural America. I chose this topic for a reason. I visit and consult and have done so for 35 years. I've consulted nursing homes, assisted living, hospice, home health hospitals, behavioral health centers, so on and so forth. Most of them are in cities or in suburbs, but I have gone to a lot, way out in the country, way off the beaten trail. I know where every cornfield is in probably 5 states. I'm talking about rural America. Allow me to explain. The shortage of healthcare professionals in the United States has been a problem, and it's a growing problem, but particularly in rural areas across the country. A recent brief by the National Rural Health Association reports this. Around 33% of the population live in what are called, quote, health professional shortage areas, end of quote, or HPSAs. 77 million live in a dental health HPSA, and almost half live in a mental health shortage area. That to me means access to necessary services is a major problem, if not difficult or somewhat challenging to get to, sometimes impossible maybe. These shortages create greater inequities in access to health care. They strain local economies, and they reduce services to the community that they need. Programs aimed at this problem have tried to improve this situation, but only with minimal effectiveness. The National Rural Health Association proposes some fresh ideas to help. Let me introduce a term to you that I don't believe I've heard before: medical deserts. Another term similar to primary healthcare professional shortage area is a medical desert, and it signifies a gross maldistribution of healthcare workers. For instance, 20% of the U.S. population, 1/5, live in rural areas, and only 10% of every doctor in America practices in those communities. That is way out of whack. Due to insufficient access to healthcare, medical deserts are troubled by inequities in access, longer wait times, reduced service complexity. They just don't have the abilities to have these trauma centers that we need, or psychiatrists, behavioral therapists or counselors, addiction specialists. They also run the increased risk of mortality and fewer health services in general. Think about it. Someone is dying, they had a heart attack or a massive stroke, and the first healthcare facility, the closest one that they can get to, is a half hour away. What are the odds? How do we improve healthcare in rural America? I have a proposal for you, and it's from the National Rural Health Association. They propose a 4-point plan, keep it nice and simple, to improve healthcare in rural America through both non-institutional, which means outside of the organization's control, as well as institutional factors which can be controlled by the company, the hospital, the nursing home chain, the assisted living company, and so on. Point number one. One such non-institutional area is the creation of economic stability through affordable housing, educational and spousal employment opportunities. Companies, on the other hand, can work towards equitable compensation and benefits, at least make them competitive. A higher living wage for hourly employees, bonuses to offset moving from this state to that state or from city to the country, temporary housing, and child care cost assistance. Point number two, create a sustainable neighborhood and environment that is geographically close to healthcare facilities and amenities like shopping centers, restaurants, and so on. This could ease the shortage in healthcare workers. You're building a new community for healthcare workers to move to and live in comfortably. Companies may wish to partner with local builders to develop affordable housing, short-term rentals, or work with local hotels to ease the burden on healthcare workers seeking jobs in these rural areas. Point three, develop rural communities socially and contextually so that they're more attractive and they provide a good quality of life, social cohesion, non-discrimination, and civil participation. It's community building. For instance, only 20% of rural Americans identify as non-white, and only 10% of rural physicians are from minority groups. Again, we are out of whack, off kilter, out of balance. Companies can develop from this far better planning. Recruiting and retention programs can be built with educational opportunities aimed at rural citizens, their children, and their spouses. Point four of this plan, a final non-institutional means of recruiting and retaining healthcare professionals in rural America is to provide access to high-quality education and professional development not only to employees, but a good school system for their children. People, I've seen it, you've seen it probably, we know this. If I want to relocate to get a better job, better career, more money, or whatever the case is, and I have school-age kids, the first thing I'm doing is checking out those school systems. Companies can then offer work-life balance, assist with child care, reduce geographic barriers, enable access to specialists, and support dual career households through remote work opportunities for the spouse. So there you have it. My final thoughts on recruiting and retaining healthcare professionals in rural America. The United States, as we know, has a deficit in healthcare professionals across the entire country, but rural areas are especially in trouble for a wide range of reasons. Society as a whole and healthcare companies specifically can do something about this through concerted efforts to improve these so-called medical deserts and turn rural America into thriving communities that provide stable employment, education, affordable housing, amenities, and a good quality of life for healthcare professionals, their spouses, significant others, and their children. Thank you so much for your time and attention. I'm Dr. Jim. If you'd like to stay in touch with me, email me sometime. Jim@collinslearning.com. I love it when people ask questions, request different topics, share stories. And if you're looking for CEUs for yourself, check out CEU Academy. If you or your company is looking for a new online learning management system with all the compliance requirements, we have a very robust LMS and it is collinslearning.com.